minutes.
Thank you, Mr. Speaker. Mr. Speaker, I rise today and ask you to consider where we were before the Affordable Care Act. Premiums were rising 3 times faster than wages and eating up much more of Americans' hard-earned paychecks. Millions more families were drowning in medical debt. Americans had to pay for critical preventive services like flu shots, yearly checkups, and birth control, and many young 20-somethings went without insurance. Your suffering child could be denied coverage due to a pre-existing condition. The so-called donut hole or gap in Medicare Part D coverage was forcing many seniors to choose between buying food or saving life prescription or buying life-saving pills. Women were charged more than men for coverage simply for being women. And insurance companies could set annual or lifetime dollar caps on benefits, sticking American families with the remainder of the bill. Thankfully, in the 6 years since the ACA was enacted, 20 million Americans have insurance for the first time in their lives. And the uninsured rate is the lowest it has been in American history, currently at 8.6%. The ACA has helped 105 million Americans, including 39.5 million women and nearly 28 million children, by preventing health care plans from capping benefits. We have also seen that the marketplace is working better in states where elected officials collaborated to implement the ACA rather than trying to undermine it. In states that chose to expand Medicaid, insurance rates are an estimated 7% lower. In contrast, governors and legislatures in 19 states have blocked Medicaid expansion, even as millions of their lowest income residents go without insurance coverage. Unfortunately, over the past few years, it has been popular around here to say that ACA is a failure, that it is socialized medicine, and that it has driven down the quality of American health care, that we need to repeal and replace it because Obamacare isn't working. This mindset is all wrong, because I'm happy to report that ACA is working. However, faster progress has been prevented due to obstruction and politics. Since being signed into law in 2010, my colleagues across the aisle have voted to repeal all or parts of the ACA over 60 times. This has prevented funding needed for implementation and necessary fixes to the law. It is time, once and for all, for Congress to accept the ACA as the law of the land and begin working to improve, not to repeal it. Now, I understand there are challenges as the law continues to take deeper roots throughout the health care industry. As they prepared for ACA, some insurance companies set prices too low, and they are now adjusting them in response. But I want to remind everyone that the insurance marketplace was dynamic before the ACA and will continue to be dynamic. ACA calls for a more innovative approach to health care, and many insurance companies have adapted so they can focus on coordinated care and care management, for example. When insurance companies were still able to discriminate based on pre-existing conditions, they excluded or undervalued expensive patients, the same people who had the most health care needs. Now that actual data is available, the market is undergoing a natural correction to bring prices in line with cost. And it is important to note that shopping on the marketplace has proven to help all consumers find the best price for coverage. According to the Department of Health and Human Services, almost half of returning healthcare.gov consumers switched plans and saved an average of $42 per month. I understand that challenges with the ACA remain. That is why HHS is taking steps to address these problems. And Congress has a duty to look for policy solutions that improve everyone's access to the best care available and to make that care affordable. There are real ways that Congress can provide stability to the health care marketplace, and I urge my colleagues to bring some of these solutions to the floor. I was proud to vote for the ACA, and when the majority is ready to get serious, I will be proud to vote for common sense improvements and reforms to the law. The American public has spoken, and they will not return to the days before health care reform. It is time for Congress to listen to the American people. Thank you, and I yield back.
Chair